Joining us now, Dr. Fahmi Farah, who is a cardiologist and also a medical specialist, obviously, to talk about the benefits of olive oil. Doctor, welcome back in. Thanks for being here.
Hey, thanks for having me.
So I've had this discussion before with doctors, and I talked to other people that have seen cardiologists, and, some say stay away from oils at all if you've got serious, heart issues, heart disease, calcification, things of this nature. But so there's a new study now. I guess American College of Cardiology found that half a tablespoon of olive oil does all kinds of good things for you. So where do you stand when it comes to oils and what's going into your body relative to heart disease?
Yeah, olive oil is the healthy option when it comes to heart disease, and the new study is great. It shows, gives us more evidence and more power to the fact that we should be substituting things like butter and other forms of oil with olive oil if possible.
The different types of olive oil, does that matter, or just olive oil?
All forms of olive oils are good, but it's the extra virgin olive oil that has the most benefit.
Do you put your patients on this kind of regimen if they've got, problems with their heart?
We do. We ask all our patients to follow a heart-healthy diet, and part of that is to make sure that the oil they're using is healthier, and olive oil is the healthier option. And, I do want to say that it's not to say that people should just take a tablespoon of olive oil by itself every day. It's more as a substitute for other forms of oils to make it more healthy.
Salad dressings, good idea there to consume it instead of just having to drink it like castor oil.
Yes.
So the other benefits besides cardiovascular, olive oil, helps with the prevention of cancer, dementia, respiratory illness.
That's correct. Olive oil helps with dementia, cancer, pulmonary diseases. So it has benefits for other parts of the body, not just the heart, the vasculature system, and the cardiovascular system. So overall, it really is considered to be the healthier option, partly because it is very high in monounsaturated fat as opposed to some of the other oils.
Right. Now, the problem with me and olive oil is I just love the taste of butter. I can't imagine putting olive oil on my pancakes.
I know, but butter is not so good for you, though.
Well, it's got to be better than margarine, isn't it? I mean, that fake stuff?
Fake stuff is not good. Of course, we should not be substituting real butter for fake butter. But really, real butter is not any good for you either. It has high amounts of saturated fat, cholesterol. Mm-hmm. So that's a building block for your blockages in the heart, and that can lead to heart attacks. So it'd be a good idea to minimize the amount of butter you're using in your food and substitute that for olive oil.
All right, so how much olive oil are we talking about that everybody ought to put into their diet at some point in the day?
We're talking about 1 tablespoon, half to 1 tablespoon.
Yeah, that's not bad. Not bad at all. All right, well, I'll give it a run. Thank you so much. I don't want a heart attack today, so pass the olive oil. Dr. Fahmi Farah, appreciate you.